What to expect in labor? Labor comes in three forms, three stages. The first stage, which comprises of two phases, the latent and the active phase. The second stage, the third stage. The first stage starts from 1 cm to 3 cm, that is the latent phase of the first stage. Then from 4 cm to 10 cm, which is the active phase of the first stage. During the latent phase of first stage of labor, you will notice rhythmic uterine contraction. When I mean rhythmic uterine contraction, it's just mild abdominal pain or painless abdominal movement, like contraction, something that is not painful. Sometimes it has this resemblance with the menstrual cramp. Then you can also notice if there's some persons, their water may rupture, that is rupture of bag of water. And you can also notice what we call show, which is just a bloody-like substance that is stretchy, that comes out from the private part. It's known as show. So once it comes out, it's a sign of labor. But sometimes you may not see it in the first stage of labor. You just have to come to the hospital once you notice any of these signs. Let me explain. There are some signs you notice at home before you can say, oh, this is labor. We have what is called uterine contraction. Like I said, mild rhythmic uterine contraction. It will seem as if the stomach is bloated, hardened, but it's usually painless. Then you can also notice the other, which is show or rupture of bag of water. Any of these signs that you notice, you come to the hospital, because the major one that determines that you are already in labor is the one we call cervical dilatation, which you yourself may not be able to identify in the house. So when you report to the hospital, the midwife examines you and then tell you are how many centimeter dilated. So back to what I was saying with the first stage of labor, which I said it comprises of both latent and the active phase. The latent phase is from 1 cm to 2 cm, whereby the midwife examines the woman, and if the labor is about 1 or 2, the cervix is about 1 or 3 cm dilated, you can just admit the individual, rehydrate, and then reassure that woman. The woman can also move around just to be able to reduce the pain or the stress he or she is having, to say. Now, the second phase of labor, which is the active phase, it starts from 4 cm to 10 cm dilatation of the cervix. During that period, the contraction tends to be more intense, they're more regular and frequent, and then painful, because at that point there will be severe pain at the back of that woman, but it goes from time to time. Then the midwife will check both your vital signs, like she has been doing during the first phase. She will check your vital signs, which comprises the blood pressure, the pulse, the fetal heart rate, which will be usually monitored every 2 hours. The blood pressure also every 2 hours. Then also the cervical dilatation. Usually we don't examine a woman in labor every now and then. Cervical dilatation is done every 4 hourly. Reason to avoid introducing infection into that individual. So sometimes you find out that some women will be crying and shouting, "Nurse, come and touch me. Nurse, come and examine me. Nurse, come and do this to me." Sometimes we usually don't do so, but we just reassure that person, because if you continuously examine or insert your fingers into that woman, she may contract infection, which is not so wonderful. So on that note, the midwife will examine the woman every 4 hours. We do vaginal examination every 4 hours. Then every other examinations, like the vital sign check, the blood pressure, the pulse, the temperature, and every other thing will be done intermittently, 30 minutes, 1 hour, or thereabouts. Once it has been ascertained that this woman is about 8 to 9 cm, she will be moved into the second stage room, and there she will be closely monitored. While in the labor room, she will be hydrated, obviously, and then she will be monitored closely. Once she's 10 cm dilated, that ends the first stage of labor, and that is where you now advise that woman to bear down. When I mean bear down, to start pushing out her baby. So that is where the first stage of labor ends. Then the second stage comes in instantly. During the second stage of labor,